Hair loss. Alopecia. The commonest causes are alopecia areata, tinea capitis, trichotillomania, traction alopecia, and telogen effluvium. Alopecia areata is thought to be an autoimmune disease. It affects the hair follicles, and they are converted from a anagen or growing phase into a telogen or resting phase, after which they are shed. There is a higher incidence in some families. It is associated with other autoimmune conditions, like thyroiditis, celiac disease, vitiligo, as well as asthma, and atopic dermatitis. It presents with sudden, rapid hair loss. This may be in a single round patch or multiple patches. Mostly affects the scalp but may involve other areas, like eyelashes and eyebrows. Sometimes may have alopecia totalis, with total loss of hair on the scalp.
Or alopecia universalis, with total loss of all hair on the body.
The skin looks normal with no scaling or redness. The hair pulls out easily at the edges. Typical hairs are called exclamation point hairs because they are short and are wider on end away from scalp. In 10 to 20% there may be nail changes. Pitting, with small pits in the nails. Onycholysis, which is lifting of the nail plate off the nail bed. Trachyonychia, which is thinning of the nails as well as ridges on them. A single patch has a good chance of remission by 6 to 12 months. The larger the area involved, the less chance of remission. It often may recur. It can be treated with mid-potency topical steroids initially. One can add minoxidil 5% solution applied twice a day next. Limit this to small areas to avoid it being absorbed and causing systemic side effects such as fluid retention and cardiac effects like hypotension. Steroid injections are also sometimes effective. Immunotherapy may be used in severe cases. Tinea capitis. This is a dermatophyte or fungal infection of the scalp. Trichophyton tonsurans is the most common, seen in 90% of infections. Microsporin canis is less common and spread more from domestic animals. Microscopy with potassium hydroxide will show spores inside the hair shaft with trichophyton since it is an endothrix infection. Spores outside the hair shaft with microsporum since it is an ectothrix infection. A culture of a hair or skin scraping is the gold standard test. A Woods light exam will only fluoresce with microsporum infections. There are different presentations. There may be diffuse areas of white scale with mild or no hair loss. There may be oval patches which have hair loss, scale, or black dots which are broken off hairs. There may be inflammation with pustules, crusting, or acurion, which is a boggy swelling. There is usually lymphadenopathy present. In the treatment of trichophyton tonsurans, the drug of choice is griseofulvin. It is FDA approved in 2 years and up. It comes as a microsize liquid or ultramicrosize tablet. Therapy is usually 6 to 8 weeks. No labs are needed unless used for more than 8 weeks. An antifungal shampoo twice a week is often used to reduce spread. Ketoconazole or selenium sulfide shampoo. An oral steroid is helpful when there is acurion or multiple pustules. If griseofulvin is not working, then terbinafine can be used. It is FDA approved for 4 years and up. It comes as tablets. It is given for 4 to 6 weeks. Or granules. A baseline liver test is needed prior to starting. If over 6 weeks of therapy, then liver function test and blood count are needed. Other options: fluconazole, for 3 to 6 weeks. Itraconazole for 4 weeks. Both need initial liver function test. Trichotillomania. This is hair loss caused by pulling on one's hair. It is classified as a form of obsessive-compulsive disorder. It occurs most commonly to scalp hair but may involve other areas such as the eyebrows. The hairs appear broken off at variable lengths. The skin is normal looking. Treatment may need psychology or psychiatric help. Traction alopecia. This is due to hair styling that pulls on the hair. The distribution depends on the hair style. It is seen most commonly around the frontal or temporal areas. Some vellus hairs may be present. The skin is usually normal. There may also be some folliculitis from use of hair treatments. It is treated by changing to a more loose hair style. Telogen effluvium. This is diffuse shedding of hair. It is due to conditions that move hair from a growing anagen phase to a resting telogen phase, after which they are shed. The hairs are shed 6 to 12 weeks later. This shedding can last 3 to 4 months. The skin looks normal. Some causes: high fever, severe illness, surgery, general anesthesia, medications, malnutrition, thyroid disease, iron deficiency anemia.